The balance system works like a global positioning system, or GPS. And the way a GPS works is it takes 3 different satellites and averages them together to tell us where it is in space. Our body does the same thing. And what our body uses is information from the eyes, information from the ear, and then information from the position receptors along the knees, hips, ankles, and spine. Our body then goes ahead and averages those 3 together to tell us where we are in space. When those don't agree, we get dizziness. When we see people with dizziness, what we start with is a detailed history and physical examination of the ears, nose, throat, and balance system. We look in the eyes because they're intimately connected into the balance system, and you may be asked to fill out a vision questionnaire. The most common form of dizziness is benign paroxysmal positional vertigo. This is when a crystal from the utricle, part of the inner ear, breaks loose into the gyroscope or semicircular canal, part of the ear. These patients will experience spinning vertigo when they lay down or roll over in bed. The way we diagnose this is we lay people back in the exam chair and look in their eyes and see if their eyes rotate and spin. If they spin in the anticipated direction, the diagnosis is made. This is treated with a modified Epley maneuver where we reposition those crystals back into the utricle. The second most common form of dizziness we see is called vertical heterophoria syndrome. In this situation, the eyes and ears are fighting with each other and not telling the brain together where they are in space. These patients have symptoms of double vision, eye strain, car sickness, dizziness in big stores, problem reading, and problems with depth perception. We find in these patients they have one eye that's typically higher than the other, and my belief is that there's part of the inner ear called the utricle which doesn't work properly. In these patients, we've developed a way to help them with custom fit eyeglasses with prism in it to help get the eyes in alignment. Locally, we've helped 8,000 patients so far. Last year, I was able to present our research internationally in Sweden and Scotland. And this year, we're fortunate to have our first optometry students come out of state to start to learn how to treat this disorder. Tests that are used to treat the balance system include video nystagmogram, or VNG. This is a test where at first video goggles are placed on the patient. Patient is put into different positions to measure for positional dizziness. Following this, the right and left ear are stimulated with warm and cold air to compare the right ear to the left ear. The new test that we've obtained in the office is a vestibular evoked myogenic potential, or VEMP test. This test is new in that it's going to start to measure other parts of the inner ear that in the past we have not been able to measure. These are the utricle and saccule, which I believe are related to the visual disorder that we treat. In those patients who still have continued dizziness, at times medicines help to reduce those symptoms, and in some patients, physical therapy is used to help reintegrate the balance system.